Sure thing. Thanks, Shana, for the introduction, and good afternoon, everybody. So I'm going to go ahead and share my screen so that everybody who is logged into the GoToMeeting will be able to see my screen for this demonstration. So just as I'm getting started, I wanted to provide just a little quick background on PolicyMap and then kind of talk about the what we've done working with the American Cancer Society so far, and then talk a little bit about kind of what the training consists of and what this demonstration consists of. So, the quick background on PolicyMap is, so we're a nationwide online mapping and data platform. So we have almost 40,000 data indicators from public sources like the census, as well as some proprietary data sources that we license on things like home sales and vacancy, and we make the data available in an easy-to-use mapping and reporting tool. So our data is going to kind of span, the gamut from demographics and income and poverty and housing, jobs, health, education, other areas. PolicyMap has been used for research purposes, market studies, business planning and site selection, grant applications, impact analysis, community health assessments, and just kind of general data visualization. So we've been working with the American Cancer Society on the creation of this ACS Health Equity Community Projects PolicyMap site, and so it's kind of a unique instance of PolicyMap that is available to all the community project teams. So you should all, eventually, I know Shana mentioned, they're working on getting everybody set up with the access. But all the project teams will have access to this tool. It includes all the functionality and data available in the PolicyMap platform, along with a few customizations, which I can point out. So for the training, I'm going to start with just sort of an overview of some of the basic functionality of PolicyMap, talk about some of the data that's available, where you can find it, and then jump into how to quickly create maps, and then touch on some additional functionality like generating reports, and then some more advanced features like creating custom study areas, loading your own data through our self-service data loader, and then our data layering tool. And so we'll kind of just see, how far we get. Some of those things we may not be able to get to. It's always kind of a more ambitious agenda, and I do like to at least leave a few minutes at the end for a Q&A session. So kind of all that being said, there's only, less than 10 attendees signed in to the GoToMeeting, and, everybody's line is open. And so, it is a small, relatively small group. So, I think it's fine to also keep this kind of interactive, so you're not just hearing me for the next, hour or so. So if folks have questions, as we're going through the demo, feel free to, just ask them as they come to mind. And, if there's, any kind of like questions or use cases that kind of come to mind as you start to see, what data is in here and what things you can do with this tool, that you might, want to explore a little bit while we're on the call, that's fine. So just feel free to jump in. So I think the first thing, so everybody should be able to see my screen. What you're seeing right now is essentially kind of just this login screen or this landing page for the ACS Health Equity Community Projects PolicyMap site. So you would get to this by any web browser. This is a totally web-based tool, so any computer or internet access, you should be able to get here just using the URL cancer.policymap.com, and you'll see this screen. And once you have your username and password, kind of your credentials set up, then you'll be able to log in to the site to start using it. So when you log into PolicyMap, as I mentioned, it is a nationwide tool. So you kind of land on our maps page, you see a map of the United States. And so a couple of resources to point out. We do have a support page that has just kind of a lot of guides and tutorials and things like that. I always like to point out. So When you're on the maps page, you can find it on this little question mark icon in the top right corner. And when you click on that, it'll take you to our support page, and it just kind of has some general guides on how to create maps and generate reports and, the different features and functionality. And we also have, some like training videos, quick start videos, as well as just kind of like a general support phone number and email address. So all those are just resources to be aware of. And then the other one is we had put together just kind of like a 2-3 page quick start guide for the community projects, site, and so I believe that is also going to be available to all the community project teams, just kind of with other training materials and things like that are going to be made available to you all. So as far as just kind of interacting with the map, you can, pan around on the map holding down the left click on your mouse. You can use the scroll wheel to zoom in and out to different areas, on the map. So if you're just kind of familiar with working with any kind of online mapping or anything like that, all that should feel pretty familiar. There's a few kind of elemental or kind of foundational features throughout PolicyMap that you'll see. And one of them is this set location bar up here above the map window. And so this will allow you to zoom to any area on the map. You can enter in like a specific address or a county or state zip code. And once you start typing something in there, you'll be able to select from a drop down or just search for that location, and it will zoom to that area on the map. So if I start typing in something like find Gary, Indiana, and I could select that option, it'll zoom to Gary, Indiana. It just kind of shows me the boundaries for the city of Gary. The other, real foundational functionality of PolicyMap is going to be where all the data is available in the tool. And so all of our data is available from these data menus at the top of the screen, just right above the maps window. So pretty much, everything from this demographics menu all the way over to analytics is data that's just sort of built into PolicyMap and is just part of our platform and that we're updating and maintaining. We have all the data grouped by theme rather than by source, just to kind of make it easier to find what you're looking for. And so when you open up these menus, so if I look in demographics, you'll start to see what data is available, what you can, start to explore. So you'll see there's population data and there's different demographic indicators on things like race, ethnicity, diversity, age groupings. As you hover through these menus, you'll see that there is, kind of more general indicators or data layers you can load on the map, and then more specific ones. So when you go over age, you can look at median age, or you can look at something like the percent of people that are in one of these specific age buckets. So as you kind of navigate through these, you'll see that they branch out and into all these more specific layers and data sets. So I won't go through all of the data menus to show you, but as you scroll through, you'll see kind of how things are organized and where different data is sourced. And it's just going to take it takes a little bit of just kind of like spending some time just exploring the data menus to sort of see all that's in here. So the other thing that I'll just kind of mention about the data in PolicyMap is that it's going to vary. There's going to be some variance in terms of geographic availability. So some of the data in PolicyMap is going to be available at very kind of small geographic boundaries, below zip code level, things like census tracts or census block groups. Some data will be just available at larger geographies, something like a county level or something like that. And that all really just depends on the source that the data is coming from. So we do have our data directory pretty, heavily documented, which you can access from this little data directory icon in the top right corner. If you want to just kind of see the full list of data sources that we have, And I'll also show, as I'm kind of interacting with some data on the map, how you can see, identify source information for individual data that you're looking at. So the demographics through analytics is, sort of what's part of PolicyMap. We also have in the community projects site a custom data tab over here on the far left-hand side, which says community projects data. So when you open this one, it's really just kind of like a curated sort of subset of data layers and data points that, were identified, by us and American Cancer Society as, these data layers that would be particularly relevant for the community project team's kind of use of this tool. So you'll see under the data layers, there's cancer incidence and mortality, and then kind of some more specific indicators by cancer type. There is, and then there's kind of these layers that are related to the 3 social determinants of health focus areas. So the financial hardship, things like poverty, income, low-wage workers, unemployment, so some of that financial hardship data, food access data from both USDA as well as a nationwide supermarket access analysis by our parent organization, Reinvestment Fund, food insecurity, some transportation access indicators on things like mode of transportation, travel time to work, households without vehicles. There's some other health data on risk factors, access to health insurance, medically underserved areas, and there's data points on things like grocery store locations and farmers market locations and locations of health facilities like hospitals and community health centers and lookalikes. So, like I said, it's kind of just a curated subset of our data kind of warehouse to identify those things that may be particularly relevant to the community project teams. So the other resource or kind of tool that's available is we do have a data search box. So just to the left of the location bar where you can set your location to zoom to an area on the map, there's also a search bar to find data from throughout these menus. And so if you start typing in keywords like hospital, you'll see the results, and then you can load, like selecting one of these, you can load that data on the map, and this one is just going to be a point data set of the locations of hospitals. So that's just also a piece of functionality that may be useful. So the 2 main types of data that are going to be available in PolicyMap are going to be data layers and then data points. And so the data layers are going to be, shaded areas on the map that'll kind of show you, the darker areas where there's a higher percentage of poverty or there's a higher median household income or something like that. And then data points will be the actual address level data, like that hospital data, which just shows you the locations of things like hospitals or health centers, grocery stores, libraries, bank branches, just to name a couple of other point data sets available in PolicyMap. So I'll go through just kind of an example of creating a map, working, kind of loading a data layer, loading some points, and then kind of show what you can, what you can produce once you've created a map in PolicyMap. So I'm going to zoom to Little Rock. For this example, and so the data layer that I'm going to load is going to be just sort of the general poverty rate. So I'll go underneath community projects data, financial hardship, poverty, and just put on people in poverty. So you'll see this is going to be a data layer. So in this example, it's showing you % of people in poverty. Darker purple areas are going to be where that percentage is higher, lighter purple where that percentage is lower. So anytime you have a data layer displayed on PolicyMap, you'll see a map title across the top. It tells you what you're looking at, what the specific data layer is. If you click on this, you can see more of a description, and then there's also a link to our data directory to go see a little bit more information about that particular data source that this layer is coming from. And you'll see over in the legend, it's telling you that this is coming from the census. And you can also click on this link right here to get to the source information for that particular data layer. So this is going to be, so there are a couple of other options available over here in the legend for the data layer if you want to kind of just change what you're looking at. So you can change your year dropdown. If you wanted to go back to a previous time frame for the same data layer, you can change that. There's also the ability to change your variable. Right now it's showing % of people in poverty, but maybe you want to look at something more like an estimated count or number. Then you can select that from the variable dropdown. It'll dynamically just kind of change the layer on the map to show you now its estimated number of people living in poverty. And then there is also the ability just to kind of change around some of the visual pieces. So if you wanted to change your color and use kind of a different color ramp, you can do that. I tried changing that from the color dropdown. And you also have the ability to kind of modify your ranges if you wanted to, say like the bottom sort of range within your data should be, 0 to 10% or something like that, and then everything else upwards from there. So you can change these cut points a little bit just to kind of change what you're looking at there on the menu, or on the map. So there are some different, things that you can do as far as just sort of manipulating what data you're seeing by changing the different options over here in the data layer legend. The other dropdown here is going to show you how the data is being shaded. So it's telling you that you're looking at % of people in poverty by census tracts right now. And so if you zoom in or out, you'll see that this may change. So I've zoomed out a little bit, kind of more of like a metro level type of zoom, and you'll see that now it's shading it by zip code area rather than census tract. If I keep kind of zooming out, eventually this will probably switch to a county. And so that's all going to dynamically be tied to, how close or far you are zoomed on the map. But you also can change this more manually. So if you're like at this zoom level and you wanted to still see zip code area, then you can change that from that shaded by drop down, and now you're just looking at this data at the zip code level. So, this is obviously going to be your kind of showing you the higher poverty areas and the darker green. You can find out, the individual, for an individual census tract or area on the map. If you click on the map, you'll see the value for that area that you clicked on. So this is showing me, for that particular census tract in kind of Southwest Little Rock, the estimated % of people in poverty is just shy of 50%. And then it shows you the benchmark values for things like the city and the county and the metro area and the state in which, that census tract is located. So you can kind of easily be able to say, oh, this is a high poverty census tract. It's only 50% here relative to, the state of Arkansas, the % of people in poverty is only 18%. So that's just kind of the quick way you can get to those types of conclusions. So that's kind of some of the things about interacting with the data layers. And then I'll go ahead and load a data point. So I'll load some of the health facility data points on the map. So I'll put on the hospitals, and I'll also put on the health centers. So they're going to be these orange icons that you see on the map. So when you click on an individual point, you'll be able to, see the attributes. In this case, I clicked on one of the hospital locations, so it's telling me, some of the information, the facility name and address, some of the staffing information. So all of this is going to really vary depending on the individual, source or, what data set you're looking at. So you'll see, even if I click on one of the community health centers, it's going to be, widely different attributes for the health centers compared to the hospitals. So you can click on the points to see the details of that individual data point. And then there's also filtering on data points in policy maps. So if you wanted to, filter for a subset of points, or in many cases, you can also kind of just color code by one of the filter groupings. So for example, we wanted to just show community health centers that are kind of like full-time operational schedules. You can scroll through the different filters that are available and see health center operational schedule, and you can either do a color code to keep all the points on the map and just color code by this, or say, I just want to see the full-time ones. And now, it's just going to show those points on the map that are your full-time health centers. So now you've got this, data point on the map, you've got this data layer. When you do have data points on the map and you click on the map, you'll be able to see a list of points that fall within the area that you've clicked. So you say, this is a high poverty area. It looks like there's a couple of hospital locations. You want to see that list of hospital locations, and you can pull that up and see the attributes for those two in this kind of just quick pop-up list. And so in this, just example here, you've got your data point on the map, you've got your data layer, and so this would be kind of an example of being able to, you can start looking at, how do these high poverty areas in South and kind of Southwest Little Rock, what types of, what are some of the health facilities that seem to be, serving these areas. And there's, when you kind of pan around through sort of the rest of the map view, you can see there's, pretty high concentration up here, sort of in more central and west of Little Rock, not so many facilities kind of south and southwest. So if you've created your map and now you want to, do something with this map, there are a few different options. So you can print these as a PDF or an image. You can download the actual data that you see on the map. You can also share links to interactive maps, and you can also just kind of save the map that you're looking at into a saved work area. So if you wanted to, export something as a PDF or a PNG image file, then you can use this print icon in the top right corner. And when you pull this up, in the print pop-up, you can, sort of orient things a little bit. You can zoom in and out if you wanted to. You can just kind of center your map. You can turn on and off your different legends if you want. You can change the title or add, more of a description. You can change the orientation, and then here's where you would say whether to export a PDF or a PNG. And then once you've selected kind of all of your options and you export this, this will just pop up through your browser. And usually the prints take, just a couple of minutes to generate, and they'll just, like I said, pop up through the browser, and you can save it locally, or if if you're doing anything with like a presentation or a report using the PNG for the image file is going to be your best bet. For downloading data, so just to the right of the print icon is the download data arrow. So when you click on this, you'll see, what the options are. So you can download either just your data layer, the data points, or you can download the third option, which is your points with some layer data assigned. So that would be like if you wanted to say, let me download my health centers and then see what the % of people in poverty is for each census tract, in which, one of those health centers sits. That would be your third option. So you would just select one of these three. On the next step, you can select your location. So in here, you're going to, set your location. You could say download this data for all of Little Rock, or you could do, the state of Arkansas. So you can kind of change around your selection here in the location bar. And then in this dropdown, you would just say how you want your data layer to be shaded. So census tract, or if you want that data at the zip code level, and then you just confirm your download, and this will come out as a CSV So you'll get this data in like you can open that up in Excel and interact with it or kind of like do some analysis on that outside of PolicyMap as well. So the next icon to the right of download is share. So in here you can, share a link to an interactive map. So if you have other colleagues who have access to this site and you want to create some maps and share some links to those maps, you can just take this link, copy it, email it, or send it a message, and it'll just kind of bring that person, whoever opens that link, it'll bring them right back to that map view. Similarly, you can have an email sent to someone through PolicyMap, and we'll just get an email at their email address, letting them know that there's a map that's been shared with them. There is some embedding, so you wanted to create like an embedded map. You have like an e-newsletter or blog or something along those lines, and there's some social media sharing links too. And then the last two have to do with the saved workspace. So if you wanted to just save the current view that you're looking at right now, you can click on the save icon. And this will launch the My Saved Work, and you can give your map a title. So maybe you want to say poverty rate in health facilities and save it. And then you can come back to your saved work by clicking on that folder just to the right of the save icon. And here's the map that I just saved. And so then here is where kind of like any work that you do and save, whether it's maps or some layered maps or custom regions or data that you've uploaded, all that will be available in this saved workspace, and then you can start to create project folders and organize your work into those project folders. So you can drag, create like a new project here, and then start to drag some things over. So I'll drag this map over into this project. Now I have this map, and then you can do similar things when you generate reports and things like that. So the other thing to mention just with this saved workspace is that we have gone through for the 6 geographic kind of community project team areas. We've gone through and just created a couple of sample maps for each area, generated kind of one of our community health report for each of the target areas, and we've organized all of that into this cohort 2 community projects project folder. So once everyone is set up with access, then we'll just kind of make this folder available to everybody, so that when you guys start working in PolicyMap, you'll be able to go in here, open up a couple things that have already been saved for you, so that it'll just kind of give you some sample maps to start getting the juices flowing. And so you'll just kind of see there's a couple of saved maps in here, and then a community health report, and that's what you'll see for each of the 6 project areas. So that's really kind of the basic functionality around creating maps, working with data layers, data points. If you ever need to, remove a data set or data point you have on the map, you can click on the X to pull off your data point or your data layer. There's also this reset map in the very bottom right-hand corner. The reset map button allows you to just basically refresh and go back to the default view. So I know I saw one question that I think Shayna already responded to, but let me just make sure that we address it. Download. Okay, so that was just a question about, creating maps as PDFs, which we just talked about, so that's good. So I know we just talked a lot about creating maps. I think the next thing I wanted to show is how you can generate some standard reports in PolicyMap. And so I'm going to talk about primarily generating a community health report for your county that your project area is situated in or falls within. And so you can get to the reports a couple different ways in PolicyMap, but the simplest is just you'll see in this default view that you're on the Maps tab up here in the very top of the screen. There's Maps, Tables, Reports, Layer Maps, and this data loader. If you jump from the Maps tab to the Reports, this will take you to our Reports page, which shows just the four standard reports that are available. So there's a community profile report, which has a lot of just demographic information, income, age. There's this community health report, which is kind of our latest and greatest report. And then there's a rental housing and a mortgage origination report. So like I said, I'll talk about the community health report because there is a lot of data in here. And I think a lot of it is very relevant to how the project teams are going to be using PolicyMap to kind of understand, cancer risks and incidents and cancer mortality and other kind of health factors and social determinants of health related to all those things. So it'll be, I think, a great resource just for giving you a lot of data and insight in just sort of one report dashboard. So you could honestly probably, the first time you log in, just kind of go in here and generate one of these community health reports first, and that'll just kind of give you a good sense of, some of the cancer indicators, some of the demographic indicators, some of the data on food access and, poverty and income and things like that. So it's kind of like you could almost start here and then start exploring in more depth on the Maps page. So, so the community health report, I'll select that one from the list, and I'm going to go through an example of generating a report for Elmore County. So you can type in your location here in the predefined location. So right now, the community health report is just available for counties, single county, or for a single census tract. So if you have, like one census tract area, one neighborhood within, maybe your project area that you're particularly interested in, then you can also generate one of these for just a single census tract. So I'll do this for Elmore County, Idaho. Just shows me that location, and then I'll click on Generate Report, and it'll start kind of compiling this. And so it tells you a little bit at the top about this report. It was, I think, designed to be able to be used for some community health needs assessments, or at least to provide some of the data that would be typically used or gathered in a community health needs assessment. And so you'll see up at the top here, these tabs kind of reflect the sections of the report. So there's some general population information, healthcare access, health behaviors, general health, morbidity, mortality, food securities, and then there's a whole section on social determinants of health at the end. So you can click on one of these to just kind of zoom to that section. So this will zoom you all the way down to the social determinants of health. We'll get into kind of all of these variables. And so that's just kind of the general layout here. As you start to scroll through, you can see this population information. If you hover over these charts, you can see the values there. You can, in a lot of cases on these, you'll also see, the value for your report area and also the state in which it sits, or the county and state in which it sits. So let me just kind of walk through, what might be a helpful way to start using something like this. So I jumped down to the morbidity section. There's some chronic condition information, and then here's kind of this whole section about cancer. And so you can see here the cancer incidence rate in Elmore County relative to Idaho in the United States. So it's overall higher cancer incidence. Then there's some chart here to show cancer incidence by type of cancer. So, the lung and bronchus cancer and colon and rectal cancer kind of stand out as far as Elmore County being higher than the state and the nation in terms of cancer incidence. And if I keep scrolling, there's some information on kind of STDs and some other disease information, and then there's also mortality information. So this shows cancer mortality over time relative to other disease-related mortalities. So cancer being the highest, and you can kind of see how this has trended over time for Elmore County as well as for the state of Idaho in that little info bubble that hovers over there. So, so this is just kind of like a quick view, kind of giving you those quick insights that, overall cancer incidence is higher in Elmore County, particularly colon and rectal and lung and bronchus cancer. Cancer mortality has increased in the last 3 years, kind of year over year, and each year it's significantly higher than the state of Idaho. And then you can start to dig into like some of the other indicators or variables for this report area, and they'll all just kind of be in this same dashboard report. So you can start to look at things like, as you scroll down, some of the food security or food access information. So this shows you, farmers market and SNAP retail locations within that Elmore County. You can see limited supermarket access areas, which are the purple areas. You can then kind of dig into some of the social determinants of health on, incomes and how does, family income in Elmore County compare to Idaho. And as you can see, it's lower. Households by income bracket for Elmore relative to Idaho, and poverty. And so this is just, like I said, I think a good way to be able to start to answer some of those questions about how does cancer incidence or mortality in your project area relate to the state, and then also to be able to start talking about some of these other social factors like financial hardship and food access. So you can, generate, like I said, one of these reports for any county or state, or any county or census tract throughout the country. And, when you've done this, you can print this as a PDF if you want to. You can also just save this into that saved workspace. And one of the things that is in the saved project folders for each project team is going to be one of these community health reports. So you'll see one of those in the saved workspace area for each of the project areas. So here you'll see the community health report for each county. So as far as kind of getting into some of the more advanced functionality, I think we probably have some time just to talk about using custom regions, custom kind of drawn study areas on the map, and then kind of depending on, we're at just about 3:15, so depending on kind of how much time we have left, we could also talk about using the self-service data loader to upload your own spreadsheet addresses as points on the map. So I'll go through, so for custom regions, as it's somewhat implied, it gives you the ability to draw like an area on the map or assemble a couple of zip codes or census tracts and create your own kind of custom study area, and then you can download data to that area or generate a report to that area. So I'll go through a use case scenario for looking at kind of like food access issues in Gary, Indiana. So we zoom back to Gary, Indiana. And from the community projects data, I'm going to load on data layer for this limited supermarket access analysis. So I've loaded this on the map. The purple areas are limited supermarket access areas. Yellow areas are ones that through this analysis were not identified as limited supermarket access. And so you can click on this map title to see kind of the more detailed description of this. And there is a lot of, documentation in the data directory about, this analysis and everything that was done by Reinvestment Fund. The kind of the broad strokes here is that, they, in this analysis, classify areas based off of car ownership and population density into these classifications, and then they basically kind of compare supermarket access across those classifications. And if you're an area that is within one of those groupings that has lower access or relatively lower access, then you're they identify it as a limited supermarket access area. So the layer itself is fairly simple, but then if you wanted to load on something like grocery retail locations and then filter for just the full service grocery stores, then you can kind of get a sense of why these areas are identified as limited access relative to some of the yellow areas outside. So so let's say we wanted to kind of use this data layer and dig into what are these these areas that are limited supermarket access, what's some other information about them, kind of what's the context, what does the community characteristics look like. So one way you can kind of get into that is create a custom region and assemble these limited supermarket access areas, and then we can generate a report to find out some more information about that area. So I'm going to click on, at the very bottom of the screen, below the map window, you can see there's this create button. This allows you to create a new region. So you could, just connect points on the map to draw this region, or in this case, I'm going to use the assembled option. And I'm just going to kind of assemble these general areas together. So I will use the block groups to pull them together. So once you start to click on the areas, it'll shade them in when you've selected them. Right, so let's just say we're kind of piecing this all together, and these are the areas that we're interested in sort of assembling and finding out some more information. So you kind of assemble whichever ones you want to be part of your group, and then over here on the right shows you the list of places that you've clicked on. Then you can click on Save Region and just give this a name. So you can say the limited supermarket access, Gary, Indiana, and then save that. And once you've saved it, there's going to be this outline around it, and you can click on the little icon, this little polygon icon, and then change the color, like the outline of this area, fill it in just so that you can kind of see it a little bit better. And this will show you your custom region area. And then if we wanted to find out some more information about this area, you can click on that icon for your custom region again, and then just click on this Get Report link. That'll take you over to that reports page that we were on before, and you can generate a community profile to be able to see some of the demographic information and income information for that custom study area for Gary. So it's going to pull together the data, and then as you scroll through here, you can start to see some of the information for this custom area, and then you can also see things relative to the county and the state. And so looking at this, you can see that for these limited supermarket access areas, population change between 2000 and 2013-17 was a decline of almost 50%, which is a significant population decline relative to the county and the state. This is a predominantly African-American community. As you go through age distribution, it also has a high share of elderly population, as well as a high percentage of households with annual income less than $25,000, so definitely lower income area. And if you kind of keep scrolling through, you'll see there's other data related to housing and housing type. There's some vacancy information. So here you can see, residential vacancy is about 25% in this limited supermarket access area. Business vacancy is almost 45%. How does that compare to the county? It's almost double or more in both cases. So this is just, you know, a way that you can sort of dig in a little bit on your custom region. It's just generating one of these reports that you can then, you know, print out as a PDF or save it. With the custom regions, you can also, you know, download data that falls within that region. So, you know, let's say you wanted to look at maybe something like some of the SNAP retail locations. So this might include, you know, some other kind of like food sources that are not captured in the sort of the grocery stores data set. You could, when you have something like that loaded on the map, if you click on the icon for your custom region, you can see a list of SNAP retail locations by clicking on that link, and it will show you, you know, some of these SNAP locations. So you'll see there's some food marts, some mini marts, and there's probably going to be some things in here that are also part of the grocery stores data set as well. But this might cover, kind of show you some other options that aren't going to be reflected there. But then you can download this or save this list into your saved workspace. And then, so that's pretty much the, you know, some of the things you can do with the custom regions tool. You can find all of your custom regions that you've saved from this menu, the My Saved Custom Regions menu, which is just to the left of the Create Custom Region button. So in here, you can see the list of regions that I have saved, and you can share these. You can rename or remove them from your list or delete them. But so, you know, if you wanted to kind of create a region and then share it with a colleague, you can share it through Policy Map, and they'll see it on their end in their Saved Custom Regions menu. So that's, I think, you know, since we are at just after 3:20, I wanted to just kind of maybe pause here and then see if there's any questions from the folks who are still on the call, or anything, you know, that you guys might want to dig into a little bit more that we've seen so far. So I'll let you guys see if anybody else out there has any questions or thoughts or things like that. Just a comment from Michael that this is fairly intuitive. I'm happy to hear it. So that's that was I think that's always something that this was created with that in mind, that this is a mapping tool for kind of kind of GIS specialists, and so hopefully it's something that is a fairly intuitive resource for you guys to use, and it's just going to be a matter of kind of taking a little bit of time to kind of explore it, explore some of the data and some of the different things that you can do with it. Okay. So if not, you know, then I would just, I'll point out a couple of the, so for the couple of things that we are, you know, didn't really cover, but they're kind of more in the advanced functionality. I'll just point out some of the support resources. So if you jump over to the support page, and you'll see there's a whole guide for the data loader, which just kind of walks you through how to use our self-service data loader to upload, you know, a list of addresses that you may have in a spreadsheet to see them as points on the map. And then the data layering tool is 3-layer maps. And so this is just going to be a guide for how to use 3-layer maps. And that really just allows you to add a couple of data layers, set some criteria so that you can kind of drill down on, you know, areas that meet multiple criteria and that kind of where there's maybe some overlap or some intersection between those data layers. So that's something, there's 2 resources that are available, and then there's also just kind of these other guides that cover some of the functionality that we've talked about, as well as some of the training video galleries and quick start videos and things like that. So I think we could probably just kind of, wrap up at that point. Did you have any questions? There's, in addition to the support resources and the just kind of general support line email address, I'm also happy to be a resource as you guys start exploring and using PolicyMap.
Hi, Brian. This is Shana. I do have one question. Thank you for this tutorial. It's a lot of great info, and I see a comment around someone ready to try it. But I know you had shared the different ways in which to share the data points. As currently, it'll be the co-chairs that will have access to PolicyMap. So do you recommend if they want to share with other members of their team or maybe even the community, does that then go back to perhaps leveraging PDF versions or maybe printing off the community assessment report? Can you share insight on how to share with those that may not have access and what may be the best versions to share, I guess I could say, on that?
Yeah, definitely. I think there's always kind of like with this type of tool, there's kind of thinking about like what you can do, sharing sort of like internally or with those who have access to the tool, and then obviously this is, there is an access level here in terms of login access. So I think there's also keeping in mind sort of what you can share and how you can share some of the information externally. So I think as far as sharing things externally, definitely I think using kind of some of the static map outputs and the PDFs and the images you can export. So map exports is great. I think also, some of like, printing or generating PDFs of some of the reports, all of that stuff, you can pretty easily just kind of export right out of PolicyMap. So, what would be a little bit more limited would be kind of like links to interactive maps. That'll be a little bit more limited to just, folks who have access. Although I will just kind of point out that there is sort of there is also basically kind of just like the free version of PolicyMap. So, there's a good chance that if you're just wanting to kind of like share an interactive map, you could also just go to our main site, policymap.com, click on the open map, and you can use kind of this free version of PolicyMap to like just create a map of using some of the data that we have available. So you could put in here, like something like, I believe the supermarket access data is available in here. The grocery stores will, but like if you just wanted to show limited supermarket access areas and just like have this map, you can, create maps in the free version of PolicyMap and have those kind of be available sort of like to more like a public audience. So the things that are obviously that are not really available kind of in the free version of PolicyMap are just things like some of the reports and downloading data and some of the more like add-on functionality. So so that's something that you could also explore, just kind of what you might be able to do in the free version of PolicyMap if you needed to, if you were really interested in kind of having like interactive maps available to more of a public audience.